Welcome to Your Healing Era, a podcast for artists, creatives, healers, anyone living outside the traditional mold who's searching beyond the conventional forms of healing. Don't forget to subscribe, follow, and rate the podcast. Thanks for being here, and let's dive into today's episode. So, good morning, good afternoon, I guess. You're on the East Coast.
It's just afternoon here.
And where are you in the world?
I am in Portland, Maine.
I love the background of the wood shelves and I can see a skull over there.
Yeah, I made sure the skull was in the
frame.
in the background. Yeah, I just got a new plant too. It's called a dragon tail philodendron.
Ooh.
It's a present, but I was like, I've never heard of a dragon tail plant.
Yeah, me neither. Okay, so I'm here with Karie Wick, and generally speaking, we're here to talk about the subtle realms of healing, trauma-informed health, which I guess is a broad topic. I think for us that we work in the healing circles, it might be more clear what that refers to. But my intention behind this podcast initially was to maybe get some clarity on what trauma-informed practice actually is in concept and theory, or actually in practice, how we come in contact with it during our work or with our own processes. So something I was thinking about right before we got on this call, and I don't want to pick bones right away with the world, but I was thinking about how there are people who are trained by, the established systems, whether you're a psychologist, psychiatrist, doctors, and so on, who treat conditions that they learn about in school, but didn't necessarily go through an experience themselves. And then on the other end of the spectrum, there's people that are not trained by the established, Western medical system, or people who just had an experience of healing themselves and then go out there and help people. So, and then there's all the rainbow in between of practitioners. I feel like you are stepping in both worlds.
That's really not funny, but interesting that you kind of touched on something that I was just thinking of right before we got on the call as well. I think in response to if someone asked me, like, what does trauma informed, what makes work trauma informed, or, what does that mean to me? I thought about that same thing. Like, there's didactic learning, which I think is really, really helpful. When you think about, let me put it this way. I thought about it kind of in the reverse, whereas I think that there are a number of people practicing different modalities who have had some sort of trauma, and then their sole kind of modality of doing trauma-informed work is just kind of applying their experience to anyone who comes in with any sort of trauma. So it's almost like, I know what this is like, so I'm gonna be a better practitioner, which I think in a way, if you haven't gone through, which who hasn't gone through any kind of micro trauma, but if you haven't gone through something and worked through it, it's hard to cultivate those skills. However, I agree with you where it's a kind of a spectrum where one end of the spectrum is experiential knowledge and then the other end is like book knowledge. And I hadn't really gotten to that part two that you just put in, which was like there's this in between and this overlap of people that kind of have dabbled in both, which my opinion is that's kind of the best way to go about being a really responsible practitioner is not to sit at one end of the spectrum or the other and just say like this makes it good enough.
Yeah, I agree. And one of the reasons I said you possibly walk in both worlds is because you're trained as a physical therapist, but you're also trained as a craniosacral, biodynamic craniosacral practitioner. Maybe you're trained in other things that I would love if you wanted to share any other things that have contributed to you as a health practitioner And also if you want to share anything about the difference in experience.
Yeah, I'd love to. Yeah, this is really sparking a lot of thought for me that I don't kind of go to the depth of, as far as like what has my experience been and why do I consider myself a trauma informed practitioner. But I'm also trained as a yoga instructor, and I trained with a really fabulous teacher who had done a depth of trauma work herself, who now trains mental health professionals. So she kind of has a lot of overlap with those two worlds. So some of my trauma information comes from the yoga, classical yoga, as taught through my teacher is Christine Weber of subtle yoga. So she does a lot of classical yoga instruction for her teacher trainees, but also through a lens of trauma informed. So I'd like to kind of give her credit. Um, and then I think through physical therapy, there was a tiny bit of emphasis on, I don't think it was even really trauma informed, but just kind of like patient relations. in
Can you give us some examples?
Um, yeah, I had some really great discussions and like experiences, I guess, in PT school through talked about, we did some motivational interviewing. In other words, like finding out where a person is at before you try to force your agenda on them. And um, yeah, we did a little bit of integration with the social work. So trying to figure out what people's adverse childhood experiences may have been, or where culturally, how to be culturally competent. So that was part of my clinical doctorate in PT, um, even though it was never called trauma informed. I think that was just, there was too much to do in the curriculum to kind of actually add in a lot of things, in my
Yeah.
opinion, that were
Yeah.
needed. Well, and I was going to say most of my like interest and some of my other like further training in trauma was really when I immediately started doing a lot of pelvic health, which a lot of people don't know what pelvic health is, but um, as you can imagine, it's kind of a more delicate area of the body and really lends itself to some vulnerability on the part of the patient and as well as the practitioner. And so there was a lot more direct language around um, trauma. And as I have found out, as we both know through learning biodynamics and cranial sacral therapy, is that um, trauma extends like way past just one adverse experience that someone may have had, or what we can't commonly think of in like mainstream as what would be considered trauma. Something that's more overt, whereas a lot of people hold trauma somatically in their bodies. And so I've really wanted to practice on any part of the body, or any person I'm working on. I want to kind of incorporate that trauma informed for them, not just, oh, this happened to them in their history, so this person I need to treat this way, and everybody else, oh, they're fine. If that makes
Yeah.
sense.
Yeah, totally. So I
Mhm.
wanted to go back for a second to what you were talking about, the yoga training that you had that was trauma informed. And I remember one time at a studio that I was teaching in New York City, they brought a trauma informed person to give us all guidance, which I thought that was really important. That was many years ago before I had the training that I do now. It wasn't just that training. Then I started noticing all the things that aren't informed in the yoga spaces, and not even trauma informed, just like sensitive. Like
Yeah.
I'm a person that questions a lot. And through yoga, I actually started to notice, because in my first teacher training, I was told that my feet had to be parallel, and that felt weird for my knees, and I started questioning, getting into arguments with the teacher, and then learning anatomy to discover, oh, that is why my feet parallel don't feel good, and this is how we could adjust. We don't all have the same hips, and we don't all have the same body structure. Just the traditional practice of yoga could not be a perfect fit for everyone, and the adjustments that needs to be done. But on top of that, just being trauma informed in classroom, like teachers coming with hands-on assistance without asking, all kinds of usage of words and terms that started to seem more and more harmful. And thinking about the yogic principles, like the first principle is ahimsa. It's like nonviolence, which is what got me to learn anatomy for yoga teachers, because I didn't want to put people in a posture that's going to harm their body. Like, we need to know what we're doing. So all of that being said, I'm curious about your trauma-informed yoga learnings.
Yeah. I mean, I think well, first of all, I like how I really like the line. You said something about not just trauma, but just being sensitive to different people's everything, to people's bodies, to people's sensitivities. Um, and I kind of want to go back and like kind of unwind. One of the things that really helps me is this idea of cause and effect. So let's say someone was in a yoga class in New York City for years, and just their sensitivities weren't considered, or their body structure wasn't considered, or their culture wasn't considered. Like, at some point, all of those actions become trauma, in my opinion. So it's not necessarily like big trauma or even something that you might think of, but just not being considered, especially in a safe space, whether or not it's just for exercise or whether it's actually your spiritual practice. If you come into a space and you're not considered, it's really, I think it can be really damaging. And I don't mean to be really negative about it, but it's also very uplifting to come into a safe space, and maybe not even to the level of being deeply seen or being cared for, but just being considered. Like, maybe this person does not want to be touched. Maybe this person actually has a lot of intelligence in their body, that they know how their legs need to be. So I think that's part of the training, was just really um, considering what it means to be an educator. And so safety first. So if someone's doing something to harm themselves, so as a physical therapist, I am going to tell someone like, hey, you might not want to do that with your knee, just because I know the anatomy. It's obviously your choice, your autonomy to move your body the way you want to, and this is the information I have about it. I think in yoga classes, I think there's an intended outcome, but we're not always looking at, like, am I potentially causing harm, even if I really believe like my way is right. It's like, it might just not be the right time for that person to hear that instruction or to get that assistance or that cue. So I think, yeah, going back to trauma, it doesn't mean like you have to screen people for PTSD and then just have a container around that. It's really, again, the whole person, every person that you interact with, looking at not making assumptions about where they're coming from, or how their experience is in their body, or otherwise.
Yeah, which makes me think about checking in and asking and verbal skills around these things, because we don't want to assume.
Yeah, I can't agree more. I'm like looking at my like little scribble notes, and that was really right after that point of the spectrum of different ways to learn trauma informed was, what do you need to be trauma informed? And I think one of the skill sets that's so important is.
Hey, I'm gonna pause for just a minute because I really gotta tell you about this. If you're feeling called to go deeper on this work, and if you're a woman who loves making music or exploring sound, writing songs, and expressing yourself creatively, I'm leading a retreat in Mexico this summer. It's an intimate, immersive week of embodied healing and creative expansion. We'll have a professional recording studio on site. We'll be writing, producing, dancing, practicing yoga, meditating, swimming in the ocean, all the things. So really living inside our bodies and inside our art. If this is calling you, all the details are below. We have limited spots and we have early bird pricing, so go check it out. And if Mexico isn't happening for you right now, I also have a free nervous system regulation tool that you can explore at home in your own time. And if you're ready for something more structured, my full nervous system sorcery course is also available. Everything is linked below. All right, let's get back to the episode.
I think one of the skill sets that's so important is communication. And I would also say, I'm not, I'll just say it just to put it out there, and also say that I'm not in any way really well read or practiced with this, but nonviolent communication, Marshall Rosenberg's work, I
Yes.
think is like a really good place for people to start. So yeah, just kind of like to put that out there, even though I'm not an expert or well trained in it.
Yeah, I love Marshall's work and actually got to study with one of his students who teaches nonviolent communication and mindfulness and stuff. And he wrote a couple books as well. So through him, I got into this work more. But when I think about nonviolent communication, NVC, I often think like, oh, that's how you resolve conflicts, in your marriage or in your town or things like that. I didn't think about it in terms of trauma-informed skills. So can you kind of connect the dots for me?
Yeah, I think, I mean, obviously it really works well in personal relationships. And I think when I'm thinking of myself as a practitioner, so either as a pelvic health, physical therapy practitioner or as a biodynamic cranial sacral therapist, I'm primarily working one on one with a patient or a client. And I think I also, as a really highly sensitive person, I tend to kind of draw in those types of highly sensitive people. And what I notice is, how I speak to or respond to a person when they're either on the table or even just interviewing, like seated, makes this really subtle difference. I think there's a lot to listening, and I've heard that feedback from patients for years now. Like, like it's just good to feel listened to. However, I think in my personal experience and also just as a practitioner, I think the more you can use, I statements, again, just not making assumptions about like what I heard, it sometimes it takes a little unpacking of, if someone makes a statement, I can kind of just assume I heard what they had to say and what that means to them and then take the ball and run with it. But I think if you take the time and really practice that deep listening with people, it can be very helpful. Um, and I think, yeah, one of the other points that maybe we can decide whether we want to try this to unpack this, but I think one of the things that I've noticed in my medical practice is a lot of medically induced trauma.
Hmm.
Um,
Wow, that's a big
so
one.
it's a big subject maybe for another another conversation. But when I can sit in a place of like just helping people be heard, yeah, there's a lot to unpack there, but just not it comes back to that same thing like the New York City yoga example of someone just not being considered. Same thing as a medical patient. Like if you just feel like you're not heard accurately or um or worse, that you're kind of traumatized by something a medical practitioner has said to you. Um, honestly, I don't think one session with me is going to undo that, but I think it adds positivity to their experiences rather than kind of allowing them to sit with the thought that they're always going to have that um, be treated that way, have that treatment.
Yeah. Yeah. Just for people who don't know, when you said I statements, What did you mean exactly?
Well, I think I mean, I heard you I heard you say some I statements earlier to some of my comments where, I would say something and then you will respond to me like what I heard you say or what I'm hearing
Mm,
or what I it's really kind of taking responsibility for me and not kind
instead
of
of
overriding someone else's thoughts or what they are trying to express.
yeah,
Yeah, and digging into like I'm thinking of some clinical examples with I will, I don't want to label, this type of patient, but if I've had someone who's had some significant trauma, sometimes they will come in what we call like when we look at autonomic nervous system, and a lot of us have heard of fight and flight. But I'll have a person who comes in and they are in fight mode. And so another way, in addition to reflecting with I statements, I think another way of using like that kind of from my perspective is if someone comes in swinging, like they come in and they want to pick a fight with whoever is across the table from them. Um, I think it's really challenging for some practitioners, but it's imperative to say like, you know, I'm feeling I'm feeling this way, versus saying to them, "You're being combative. I'm going to have to ask you to leave," or "Calm down. Like this is
yeah,
not the place for that." So really using an I statement in the way of really saying, I hear you. I hear that it sounds like you're angry, or it sounds like you said this, and I'm feeling a bit uncomfortable with how loud you're talking. Or, and I'm
yeah,
thinking about, hospital situations where I've been in more hospital or more kind of situations where I literally need to make sure that my safety is um, is there as well. But also, yeah, just not going into my ego or my trauma and saying, wow, that person was a handful, or they were so, they were whatever I want to describe someone who's really just challenged with being in kind of a flight or a fight rather.
yeah. Okay, and then from yoga and to PT, I mean, I don't know if that was in that order, into craniosacral therapy.
Hmm.
You mentioned in PT school. How about in craniosacral?
Mm.
I feel like every move we make is trauma informed in that field,
Hmm.
but I also would like to be able to translate it.
Yeah. Well, I think a good segue is for me is like coming from being trained as a, Western medicine type PT. A lot of like, there's a lot of time is money and like, got to get a lot done in a little bit of time. And it seems preposterous to me, but like, there's a whole model of treatment where there's no permission asked. There's a lot of like moving of other people's bodies, sometimes even moving into pain, which sometimes that's part of assessment. But I think there's these two scenarios. One, like you walk into my office and I just say, no, go, what's bothering you? And you say, oh, my shoulders hurt. And I just start like touching your body and moving your shoulder around. And that's kind of what we've been in the US, at least, kind of what we've been groomed to expect in some ways. And there's a very hierarchical, I won't say patriarchal, but hierarchical kind of way of, this is the person and they're above you and you come in. And so I have rights to do those things because that's how the system has been set up. And then the other scenario is more of how you and I have been trained with biodynamic cranial sacral in everything's permission based, and it's checking in with the person like would it be okay if I did this, and then even a step further like once you've done it, well, how is it once I've done it? So that to me is like the epitome of trauma informed because it's allowing the person to kind of go back on that decision that they made at one point in time, and then later once the scenario is happening, how is it? And then, at any point you are allowed to make a different decision, which I think is the one of the things I strive to do in trauma informed is like empower your person, your patient.
Yeah, that's incredible. So asking permission to do something and after you do it, checking in, that thing I did, how is that for you? Is this still okay? That's huge.
Yeah, I mean, the words I think of when I have talked about trauma informed to other practitioners in the healthcare setting is permission. Because that's one that just kind of just it seems simple to you and I, but a lot of people it seems um, strange. And then choice is the other word that I use in a lot of scenarios. So if I'm working with a patient and in their history, it does state that they've been diagnosed with PTSD, like I don't make any assumptions about what would make them more comfortable. And I also think there's a nuance here that again could be a whole nother conversation, but the nuance is that some people feel activated with too much choice and too much space. And so
Mhm.
I think the art is really finding how much choice that you can give someone to not assume what's going to make them feel comfortable and pairing that with creating a safe container so that they don't just feel like they're out there like and you
Yeah,
don't have any control of the situation.
containment.
Yes.
Yeah. How much space and how much containment and I want to say leadership of the session because you are the practitioner.
Yes, leadership, holding a boundary, holding space.
Mhm.
Yeah, I mean I kind of wonder I wonder if am can ask permission to turn it back on you, like, and say, like, what are your thoughts about that I just said about, like, if you were to walk in somewhere, maybe not, particularly PT, but anywhere that what makes that feel comfortable, or what are your thoughts on that?
What makes me feel comfortable
Well,
generally?
maybe not you particularly, but what are your thoughts on those that idea of, like, having choice, but also feeling like someone's in charge? Like, yeah.
Yeah. The more I'm in this field, I'm noticing these things more. I think that I personally have easier time knowing and stating or asking what I need in a session.
Mhm.
I was thinking about that before. I wanted to bring it up. I don't think that everyone does. And even if they do know what they need to feel more safe or comfortable, I don't know that they know that that it's possible for them to receive it. Like we're not even used to entering a session and having choice. Do I want to lay down or sit up, or do I want the door open or closed? You know?
Absolutely.
Or anything like that. So, that was something I wanted to ask you. I'm sorry if I'm not fully answering your question, we'll get there too.
Mhm.
I'm curious about how do you the phenomena of you giving permission, but people they're not used to n to the having the option, so they don't really checking with themselves. Like, "Oh, no, that's fine. No, that's fine. That's fine." That kind of response of like, "No, but you could really tell me." You can really have a preference. You can say
Yeah,
no. Like,
yeah. I think this is one of those things. I mean, first of all, that happens all the time. I mean, like, I think the more trauma informed I get, the more I notice how people of all types, like, will give away their autonomy and not know it. And so that's really not for me to like force them to do it, obviously. But I notice it so much. We're so unused to getting that kind of care and permission that we don't really know how to do it on one hand. And then I think that's maybe an element of the trauma itself. So there's two things, and I don't know that I explained that very well, but um, I think it comes with time as well. So, like, if you are seeing someone week after week, that's a really good marker. Like someone asking for more of their needs to be met is a really good marker that I'm doing a good job of holding that container because they are obviously and I say this kind of from the pelvic health, um, having worked with men and women who've had some form of abuse, either childhood or adult. um, it's not my job to make them trust me on the first visit. In fact, that's kind of a red flag for me if someone's like overly trusting.
Hmm.
Um, and I see this as a massage therapist as well, where I will hear people say this phrase, "You can do whatever you want to me." I may have said this to you once before, but it's like,
Huh.
ah, and I don't wanna respond with my body language when someone says that, but it just my body language is like, "Ah, no." I no, no one should ever do whatever they want with you. But it's almost like this, like, personification of their, like, embodiment sometimes. Not
Wow.
necessarily that it's a that's I don't wanna define that as, like, that's something that if you've ever said that, there's something wrong with that. But to me, it hits differently when I think through this lens. Um,
Because sometimes
to
it could be just somebody like, I know you, Carrie. I trust you.
Yeah.
Just do what your professional
Yes.
opinion. Yeah.
Yes. Yes, exactly, and sometimes it's just a subtle form of people pleasing that is also it's fine, it's not a sign, but I I really value words, and I think when those kind of words come out of someone's like, "You can do whatever you want," or, you know, without the "I trust you," there's a slippery slope into, "It doesn't really matter." "I don't really matter," or
Right.
whatever that's kind of coming
Right.
coming through.
Right.
Um, and I can't remember, I lost my thread of what we were actually answering.
I was I wanted to say one more thing about the question you asked me before
Okay.
about what because I don't know, it just came to me. What makes me feel safe in a session or what, when I walk into a room, not as a practitioner, as a client or as a patient.
Yeah.
And I think one of the most important things for me is for the practitioner to be grounded, and that could be translated in many ways, but um, at ease with themselves and present with me, because that's not always the case. Because people are rushing, doctors are rushing, or they're typing it all into the computer without looking at you for even a second.
Yeah.
I had a session, so I'm on tour and we get to sign up for PT actually. I don't know if I told
Mm,
you that.
no.
Um, it's either 20 or 30 minutes a week. And they just bring a PT to the theater where we perform, and then they bring a table. We have a thing that travels with us with all the props that a PT could ever need. So I always sign up because, just to work on my shoulder or something. I don't go in there for any serious anything
Interesting.
that's But anyway, I had a session last week. Okay, so I've been noticing the PTs, there's a different one every week. I noticed that sometimes they're stressed out because they have such little time with us and they want to make sure that we get the benefits. So they
Yeah.
do want to tell us all the things that the exercise we need to do, blah, 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 and also have like a few minutes to actually work on the area.
Yeah.
And then when they're stressed out like that, I'm familiar with that, but I'm like, it's fine. It's fine. I'm not expecting that much out of 20 minutes. I know it's not. But then some people's energy is much more grounded and that feels really good. So not the last one, the week before. It was a man and he was asking for permission for everything.
Mm,
Not overly like we do sometimes,
yeah.
but he was asking for permission, and every time I used my own cues to also I told him every time I was like, "Oh, thanks for asking. Yeah,
Mhm.
thanks for the option."
Mhm.
Because I feel like that established some kind of a trust. And there was one point, they're usually just PTs, but this guy was also a chiropractor, so I was in a bind because he was about to crack my thoracic spine or something.
Mhm.
And he was asking me where I'm from because we have a little bit of casual conversation.
Yeah.
And now with everything heated in the world, I'm like, I told him where you're from, you're asking me as I'm in a bind, you know? I just, like I thought I didn't really feel unsafe, but maybe, like, maybe I did slightly,
Mhm.
feel unsafe to say where I'm from at this time while being in a bind. And so
Yeah.
I named it, like,
Mm.
where you're
How did
from.
how did you name it? Like, name it to yourself or name it out
No, no,
loud?
to him, I said,
Yeah.
"You're asking me that as I'm in a bind," you know?
Ah, yeah. No, I
It's like
know.
subtle the subtleties, I don't know.
It's
Um,
so that is, like, so right up my alley, yeah. Of, like, not assuming, like, I think people assume questions even are like, "Well, that'll be a neutral question." You just never really know because you don't know the answer to the question, you don't know this person.
yeah. Yeah, no, but overall, um, he was somewhat informed, unlike the complete opposite of just, like, the gross example of, like, being in the Western medical system. I went to a gynecologist just for a normal checkup, and she's asking me questions as she is with the plastic machine to look inside
Mhm.
of my vagina, and she's asking me questions or to make decisions about the treatment or the next appointment or the whatever I wanna do,
Yeah.
and I think at first I was like, I don't know, I don't know." And then she pushed again, and I was like, "Well, can I think about it after you're, done?"
Yeah.
Like, after my legs
Yeah.
are not, like, open.
Yeah. Yeah.
So,
I
I
think
wish
that's a
there was
perfect example. Yeah.
of where we need more trauma-informed education.
Yeah. Yeah. I have a colleague who, it's funny, just to bring it around to like my training in pelvic health is that there's like different, again, it's all like these dualities of like, I have a colleague who a lot of times really wants to demystify the pelvis and the vulva and the vagina for folks who have vaginas. Um, or potentially, for people with penises, it's like, let's demystify it and turn it into what it is, which is an anatomical part of the body, so that it's not hypersexualized or hyper traumatized. And I get where she's coming from because you take power away from all of those cultural and historical things. Um, However, like what you said was very like, even compared to, like, being in a chiropractic bind, it's like you're still in the soma, like, you're still in the body, and you're assuming you're that this person that you're working on is in a neutral space and that there's nothing activating about the question that you're asking, and all of it is just a lot of assumptions about someone's history that, um, that sometimes it's a right assumption and sometimes it can be a very activating thing, so we're not all gonna get it right every time, but back to the pelvis, I think there's another end of the spectrum that really turns anything, having to do with, the sexual organs or the gynecological, anatomy into this very taboo, "Oh, of course it's gonna be triggering or activating," and so, I think it's important to, again, like, not be at one end or the other of that, and let's face it, like, it's a pretty vulnerable space, a pretty sacred space. And so if you're doing exams there, it really makes sense for you to be very grounded and not commonplace, kind of going on auto drive, or not the right word, but you know
Yeah,
what I mean? Like someone who does that sort of work every day as a gynecologist, they become numb to any sort of body language or kind of feedback that their patient might be like, yeah, I don't want to talk right now, or I don't want to make decisions right now. Makes a lot of sense to me.
yeah. Wow, I feel like we could go on for a while.
Yeah.
There's more things I wanna get into. I'm also aware of time, and I wanna let's just do 2 more questions that I have
Okay.
here that might be a nice, like, wrap up.
Okay.
would you have any advice for somebody who either wants to learn to be more sensitive with their own trauma and process, or with practitioners who would like to become more trauma informed and be better service for their clients or patients?
Hmm. Um, yeah, I'm giggling a little bit because some of my like thoughts in response to that question we've talked about a little bit already, so that's a good sign. Um, I think, I mean, I think one piece of that we've already talked about, which is, um, let's say you're a practitioner who's done a little bit of training through online classes or reading books, but you don't really have the experiences. I think that is a really good place to start, is kind of figuring out how your own process works, whether that's through therapy or I think one of the things that I did that was really helpful was I took a kind of a sequential um, embodiment training that used the polyvagal theory, which you and I have used with Dr. Kate's Divine Structure School in the biodynamic training. But the polyvagal theory is just a theory, but it's kind of a nice framework. Um, and I think it was through Embody Lab or Embody something. They've changed their name,
Mm-hmm.
um, but based on the work of Stephen Porges and kind of learning how the latter. I think I would recommend the work of Stephen Porges or Deb Dana is another person who has a lot of like free YouTube information. The yoga teacher who taught the class that I did, her name is Dr. Ariel Schwartz, and she is a polyvagal um, EMDR counselor. And then she just wrote a book called Polyvagal Yoga.
Oh, wow.
And so I think if you are really looking to embody the things, I think she's got like a book and a workbook. Um, and she's done this work for a long time. She has free yoga classes every 2 weeks. She's based in Boulder, Colorado, and so I did I actually did her course part one and then part two, and then I did it again. So it
That
wasn't,
must be
it's
good.
just like a couple hours, for 4 weeks in a row. So it was like probably all told like 50 hours, but then I audited it just because of the embodiment of it and the experiential of it, and it just ties together so many of the things I like to do, which is move my body, um, and you know, subtle yoga with some of the chakra theory, but really based on someone who has worked directly with Dr. Porges as a psychotherapist. So really
Wow.
well informed kind of person. So I think, seeking out, and then there's a book that Dr. Kate had recommended called Nurturing Resilience. That's another
Oh,
book that
yes.
I think is, and I haven't finished the whole thing because I'm really good at like getting books and reading a chapter or
No,
two.
I
But
I read some of that book as well because I think actually Bridget from O Chemical Alignment might have recommended that in her
yeah,
training that Kate and I did.
okay, yeah, should find it.
Um, I love all these things. You're kind of answering my other question, which was, are you reading anything inspiring or anything inspiring that you're recommending? So you're kind of already going into it, but if you have anything else to add.
No, I just think, I mean, this is my style, but like I think picking up from like learning from professionals who do this, like therapists, I think also reaching out to actual trained and licensed therapists if you are a practitioner, just always having like multiple therapists. If you're I'm thinking from my own perspective, if you're working with pelvic patients, kind of finding some sex therapists, which is somewhat hard to do, but finding really good sex therapists to work alongside of. because likely no matter what your credentials are, you can't do it all,
Mm-hmm.
and you might be falling short. And so it never hurts to kind of ask for help from a bunch of other people that have different perspectives, to help support your patients or your clients.
Yes.
Those are big things in my book.
Yes, for more layers of support, especially as a practitioner who is supporting others.
Yeah, yeah, yeah. And on top of all that didactic, my other point was like, and then do the work yourself. Do your work.
Yep, yep.
Yeah, so important.
The most important. Do the work. That's a good point to possibly end
Yeah,
this little episode.
yeah. It's been so much fun. I love talking about this stuff.
Yes. Yeah, thank you for coming on. I love talking to you about these things as well. I feel like there's more.
Oh my gosh. I do. I think so too. There's like little pockets of things. I'd be more than glad to talk again sometime
Great. So let's do it
in the
again
future.
sometime. Well, thanks for coming on.
My pleasure.
Thanks so much for tuning in. If this episode resonated, send it to a friend, share it in your stories, or take a moment to rate the podcast and subscribe. It genuinely helps this little baby podcast grow organically and reach to the people that it needs to reach. I really appreciate every comment and every review. And as always, if you want to go deeper, my course, retreat, and free resources are all linked below. This is your healing era. Take care, and I'll see you next time.